The hospitals died before the people did. First, the lights went out. Then the fuel ran dry. Then the pills disappeared. Most people didn't die from bullets. They died from stupid things. A small cut that rotted, a tooth that got infected, a fever that never broke. Out here, you don't have a doctor. You don't have a pharmacy. You have whatever fits in one bag. This video is that bag. By the time we're done, you'll know exactly what has to be inside it and which tiny mistakes will kill you first. So, let's open it. Imagine this. You slip on broken glass in an abandoned store. You don't even hear the cut. You just feel the warmth on your leg. You look down. Blood. Not a movie explosion, just a quiet stream that refuses to stop. Most people panic here. They press with a tissue. They look for tape. They hope. Hope is not a medical plan. Your bag opens. Your hand doesn't shake. Roll of gauze. Thick, rough, ugly. You press hard into the wound, not gently, not politely. You crush it like you're trying to erase the hole. Then the next thing, a proper bandage wrap, elastic. You wrap it around and around, tight enough to hurt, loose enough to keep the leg alive. Not pretty, not Instagram, just functional. Because rule number 1, your med kit is for stopping leaks. Gauze, pressure bandages, a tourniquet if you know what you're doing. Tape that actually sticks. The world ended. You're the ambulance now. Fast forward, the bleeding stopped. You don't die today. But death is patient. 3 days later, the wound smells wrong. Red lines creep away from it. Heat pulses under the skin. You feel heavy. Your head hurts. You're shivering and sweating. In the old world, people would wait and see. Out here, wait and see means wait and die. This is where most survivors lose. They stopped the blood, but forgot the second rule. You don't just need bandages. You need war against infection. Your bag opens again. Alcohol wipes, iodine, anything that burns when it touches skin. You clean that wound like you hate it. Every layer of dirt, every dead edge of skin, every memory of the glass that cut you. Gone. The air is cold. The liquid is colder. Your hands shake. Not from fear this time. From fever. You swallow water. You swallow whatever antibiotics you were smart enough to save. Old world thinking was, I'll take something when it gets really bad. New world thinking is, if you wait until it's really bad, you're already too late. Night falls. The city is a shadow with teeth. You're wrapped in a blanket that smells like dust and old sweat. Your heart is running a marathon you never trained for. You open the bag again. Fever reducers, painkillers, rehydration salts. The things people used to throw in a drawer and forget. Rule 3. Pain won't always kill you, but it will make you stupid, and stupid will kill you. Pain makes you sloppy. You don't hear footsteps. You don't notice the loose nail on the stairs. You misjudge the distance to the roof edge. Pain turns you into prey. So you manage it. You don't chase zero pain. You chase clear head. A small dose. Just enough to think. Just enough to sleep without shivering yourself into madness. Days pass. Your food is bad. Your water is worse. You eat from cans with labels half burned. You drink from containers you didn't fill yourself. Your stomach starts a war. Cramps. Noise. You run to the corner of a ruined room again and again. Dehydration doesn't care how tough you are. It just quietly turns your blood into mud. Most people don't notice until their hands start shaking when they try to open a door. Rule 4. Your med kit doesn't care how brave you are. It cares how much water and salt you can keep inside you. In your bag, tablets that kill what's living in your water, powders that turn plain water into something your body can actually use again. They taste bad. Good. Bad taste means you're still alive to taste it. Anti-diarrhea meds, not for every little problem, but for the day you know that if you don't slow your body down, you won't have the strength to even walk to where the water is. The old world loved energy drinks. The new world needs 1 pack of oral rehydration salts more than a truck full of soda. Then there's breathing. You walk through an old factory, chasing a rumor of stored food. The air tastes like rust and mold. Dust rises with every step, billions of tiny knives for your lungs. At night you start coughing, deep, wet. Your chest feels like it's trying to turn itself inside out. You remember the dead guy you passed in the stairwell. Skin gray, mouth open, foam dried at the edge of his lips. He didn't look shot. He just looked tired. Your bag opens. An inhaler, if you needed one before the world fell apart. Simple masks. Even a folded bandana you can wet and wear when walking through clouds of debris. Are they perfect? No. But if they buy you 10 more years of breathing before your lungs give up, that's 10 more winters survived. Rule 5. Protect your breathing. No oxygen, no thinking. No thinking. No survival. Then there are the quiet killers. The ones nobody prepares for. The tooth that breaks on a piece of bone. The nail that bends backwards while you pry open a crate. The blister that splits after days of walking. Tiny things. Embarrassing things. The kind of pain people hide. Out here, hiding pain is like hiding fire in a wooden house. Your bag has small tools. Tweezers, nail clippers, a simple dental kit. Thread and needle. Not just for torn clothes, but for stitching skin if you know how. Or at least closing a flap so it doesn't swing open as a doorway for rot. You don't show off these tools. There's nothing heroic about cleaning under your nails by candlelight. But this is where the line is drawn between survivor and future corpse. And finally, the most dangerous thing in your whole medkit. Not the sharp needle, not the scalpel, not the pills. It's the things you don't know how to use. The injection you saw once in a movie. The drug you think is for pain, or maybe for anxiety, or maybe you're wrong. Out here, "I'll just try it" is another phrase for suicide. Last rule. A smaller kit you understand will save more lives than a huge one you don't. So your kit isn't everything. It's specific. Bandages you know how to wrap. Disinfectants you know where to use. Pills you've actually read about. No, with dosage notes scribbled on scraps of paper inside the bag. You're not trying to be a doctor. You're trying not to be a patient. The world ended, but biology didn't. Your blood still leaks if you cut it. Your wounds still rot if you ignore them. Your brain still fails you if pain and fever beat it long enough. Most people will keep scavenging for guns, for ammo, for bigger knives, louder toys. You'll be the one quietly building a different kind of weapon. A bag full of ugly, boring things. Gauze, tape, pills, salt, alcohol that burns. Tools that don't look heroic. But years from now, when people whisper about the ones who actually lived through all of this, they won't remember the guy with the biggest gun. They'll remember the one person who always had the bag. The apocalypse doesn't care how cinematic you look when you die. It only cares how prepared you were to stay alive. So ask yourself right now while you still can. If tomorrow the lights go out and never come back, what's actually in your medkit?